today we're going to talk about wands and dilators. All right. So a lot of times in the clinic, we use these products to help really open up pelvic floor muscles. So pelvic floor muscles are just like any other muscle. They should be able to contract, but then they should also be able to relax. And so often when we're seeing pelvic floor issues, an issue that tends to run along with that is the muscles don't really relax. We run around with these high tone pelvic floors and dysfunction happens. And what we used to think in the past was, well, I'm peeing my pants because my muscles are weak, or I'm having pelvic organ prolapse because my muscles are weak. But so often what we're truly finding in the clinic is that these muscles are holding on to a little bit more tension than they should be. So pelvic floor muscles, we've got about 28 muscles down in the pelvic floor. Now, this is a paper model, but this is layer 1. And as you can see here, we've got vaginal opening and a rectal opening. Now, this is two-dimensional, so there's not a lot going on here. If we flip it around, we're going to see a deeper portion of these muscles. Now, how I explain this to patients is we've got a lot of room for compensation and error with 28 different muscles down in this region, meaning some of the muscles are going to act like type A personalities and they're going to squeeze and hold and work all of the time, just like type A personalities might do in a group project. And when you're working with 28 different muscles, again, there are going to be some that are overworking and overpowering. With that being said, though, you're also going to have type B personalities that like to stay on vacation, right? Like they want to sit back, watch everything happen, chill out, relax. And we see that a lot too. So I tend to see more type A personalities in the back around the rectal region and more type B personalities in the front, just kind of hanging out loosey-goosey. And it's our goal to really make these guys work together and talk together again. So ways that we can do that is by using products from, these are Intimate Rose products. They're silicone based, which is amazing because when I started having pelvic floor issues, we had wands, but they were cold and plastic and it felt like sticking a speculum internally, vaginally for me to stretch my pelvic floor muscles. And it was so cold, I couldn't get myself to relax while using it. So the fact that Intimate Rose came out with products that are silicone based, they feel, if you close your eyes, they feel like skin on skin. It's very comfortable. My nervous system is not ramped up like, oh, what is that? It's more like, oh, it's comforting, okay? So these products, for instance, this one is a wand. It's a little bigger up front, a little smaller on this back side. So we can use this end to help stretch vaginally tissues, muscle tissue, and then this one can stretch more rectally. So if we think like having pelvic floor tension in the front or dealing with scar tissue or maybe perineal massage to prep for baby, this is a great option. Or maybe tissue's even tight going through perimenopause or menopausal, postmenopausal, that tissue's a little bit more tight. This is a great option. This one on the smaller end is great for rectal issues. Maybe we've got some smearing, maybe we have passing of gas, maybe we're constipated. This one can help with that. This is also a great side to help with deeper internal hip tightness, okay? We do not want to insert a wand rectally and then vaginally. Make sure you're not doing that, okay? But you can go vaginally to rectally. So just saying that may change in the future, but that's currently how we are teaching our patients. Make sure you do clean these items with alcohol wipes if you are using them, okay? And then set it aside. You can also use a gentle soap or water. But me personally, I don't want to use something with fragrance on it and then insert it in vaginally because my tissue is very sensitive. So I just use alcohol wipes when I'm done with it, set it aside to dry. So back to the pelvic wand. It comes in 2 different colors. The first one is purple. The purple one's kind of their OG, the original. It just does what it does. It stretches. It allows you to get into space down here without hurting your shoulder, right? So our hands, luckily enough, reach this tissue. So we could try to stretch that tissue, any tightness that we have with our thumb. However, if our shoulders are a little tight, this gives us extra length where we can hold onto the wand, insert it in, and stretch that tissue out very nicely. That's what we really like about the wand. It's ergonomically friendly. It helps us get into that tissue in different positions without hurting our shoulder or hurting ourselves. This is the green wand. The green wand is a vibrating wand. So here are where it connects with the charger here. On the other end, there's two buttons. One is the power button, one is the vibration to tell us what different speeds that we may want. Vibration with tight tissue helps to inhibit or turn off the contraction. Think of a massage tool that you might use on your back. It helps to relax the muscle tissue, helps you to create length and stop a spasm or decrease pain. That's what we do with a vibrator wand as well. We can go into the tissue. So think if I'm having spasms down here, I'm having trouble inserting or maybe I'm having pain with intercourse, right? Prior to intercourse, you can actually use this wand, turn on the vibration, insert it in, and just let it sit on tight tissue. That vibration sitting on that tight tissue, just like it does on your back, is going to help bring blood flow and circulation to the area, help to decrease that spasm, all right? With the vibrating wand, you can also turn it off and have it as a regular wand usage. This by far is the #1 selling wand in our clinic and with my online people. People love the vibrating option, #1, to decrease spasms down there, but then #2, to also have it as pleasure effect. I've got a lot of gals that have been on our Spark It Up in the Bedroom challenge, that have worked with us with pain with intercourse, that use this for more clitoral stimulation as well, and they're like, woo, I have been missing out. This sucker is amazing. So if you don't have a wand yet and you're really working on working that tissue down there and creating space, highly recommend the vibrating wand from Intimate Rose. It's amazing. All right, next up, we've got dilators. So we've got as big as level 8. This is about the size of a male partner. And then we've got as little as level 1. This is about the size of my pinky, okay? This is where we tend to start patients off if we're having trouble with inserting tampons. So I'm thinking like my young female athletes, maybe that are in high school or even in college that need to wear tampons with running or whatever activity they're doing. This is what we start out with. The goal is to, or vaginismus might be another diagnosis. The goal is that if this tissue is tight, we want to insert it in just a little bit and let it get comfortable with just a little bit of insertion. I like to hold it here for about 10 to 30 seconds, breathe into that tissue as it's down there, keeping my pain level at like a 1 to 2 out of 10 being the lowest, right? Like a 10 out of 10 is take me to the hospital kind of pain. We want to stay very, very low, keeping it gentle, not freaking out your nervous system. If that feels comfortable, we can insert it in a tiny little bit more. Still keeping that pain threshold at that 1 to 2 out of 10 on discomfort level. Keeping it comfortable, keeping it gentle. If that pain doesn't drop or it starts to increase up to a 3 or a 4, we're pulling it out a little bit, seeing if it lessens with taking it back out. If it's still like tapped out, I'm climbing even higher to that 3, 4 or higher on that 10 out of 10, we're gonna take it out and work on some breathing techniques to help lengthen out that tissue. But that is level 1. You can see all the pretty colors that it comes in, 100% silicone based. This would be level 8, closer to that size of our male counterparts. Now, tampons and wands, we work on inserting them in vaginally. I'll go over vaginal tissue. Rectally works well too. But if we think like here, this is like 12 o'clock of a clock. This is up at my belly. We've got clitoral region, base of the vagina. We've got rectum underneath the vagina. So the base of the vagina is going to be like 6 o'clock, 12 o'clock, 3 o'clock, 9 o'clock, depending on your clock. This is a great option of how we walk people how to stretch themselves with wands and dilators. If I'm using a wand or a dilator, I want to start by inserting it in at that 6 o'clock region. At 6 o'clock, if I push down, I'm going to feel the need to have a bowel movement or have pressure down there. So we're trying to avoid that. You don't want to push into that area, or you may pass gas, which is fine too if you're working out of that tissue. But the goal is to gently come into that 6 o'clock, let it sit, let it feel comfortable, and then move it off to the side a little bit. So if this was 3 o'clock over here, I've moved it off to about 5. I'm just going to add a little bit of pressure, a little bit of lengthening there. And then I might move on as that feels comfortable up a little bit higher, maybe to that 4 o'clock, and adding a little bit of pressure. Again, keeping it gentle, keeping at that 2 out of 10 on discomfort level. Then I might move again at that 3, again holding for about that 10 to 30 second range on a hold. After I do that side, I'm going to go check the opposite side, starting at that 6, moving off to the 7 on this side, gently holding. I'm going to really pay attention, what did it feel like on the opposite side compared to this side, and start to make mental notes, and then write it down when you get done touching the tissue if you've got a wand or a dilator and are working on the same thing. The goal, keeping this gentle, keeping this calm, and really just being mindful with this tissue, okay? The same goes for a dilator as well, but that's really how we work patients through touching this tissue and getting used to it. My challenge for you all is grab a mirror and just really start to look at this tissue, get comfortable with it, eye it out, look at the color, what looks normal to you, especially if tissue's feeling comfortable down here. Know your normal color, know what it looks like. And when I tell patients, it's like dating yourself, right? We want to see what this tissue looks like. We might spread the labia open a little bit, see how it looks. Do I have any increased color, redness? What does discharge look like? Where does that sit with my cycle if I'm, whatever day I'm on, if I'm closer to ovulation? And then touch the tissue externally. How does it feel on the right versus the left? Do I have any tenderness? Come in just slightly internally, just where you're moving on the inside of that tissue. Same thing. What does it feel like? And just start making mental notes there. Check in with yourself, every now and then. It's not an everyday thing. But again, get to know this tissue. Date it. If you're having any bladder issues such as frequency, retention, urgency, or pelvic pain, pain with insertion, prolapse, think about getting one of these Intimate Rose products and start to also test the tissue out internally. Everything's gentle, nothing should be painful or uncomfortable, but really start dating this tissue and get to know it. So challenge for the day, grab a mirror, look at this tissue, get to know it, get to love it, and make a mental note of what it looks like, and then touch yourself and see how it feels. Make a mental note of what it does feel like, if it's uncomfortable on one side versus the other, or what mobility even feels like one side versus the other. All right, let me know if you have any questions on that, and have a great day.